Hi everyone, this is the continuation video of varicose vein. In this, we will talk about the investigations of varicose vein, and the most important one is the duplex ultrasound. So, which is used to determine the presence of reflex in the deep and superficial venous system. Whenever there is an damage to the valves in the superficial or the deep veins, so there will be a backflow that is known as the reflex. And to determine incompetence in the perforators in saphenofemoral junction and saphenopopliteal junction, that is the backflow from the deep venous system to the superficial venous system, and presence of thrombus in deep and superficial veins. So superficial venous reflex is defined as a retrograde flow, that is backflow, not going towards the heart. It is going in the reverse direction, that is towards the lower limbs itself, lasting for more than 0.5 seconds, is defined as the superficial venous reflex. The reflex is elicited by Valsalva maneuver and manual compression over the varicosity. So this is the normal ultrasound picture of the saphenous vein. So this is the GSV. So, and this white line what you see is the deep fascia, and the line which is seen above is the saphenous fascia or the superficial fascia. So it is present superficial to the deep fascia and within the saphenous fascia. The next thing is the Mickey Mouse appearance of the what you see in the femoral triangle. So the medial one is this is the medial part where you see the common femoral vein, and this is the GSC, and this is the common femoral artery. All these three structures forms a Mickey Mouse kind of appearance what you see in the ultrasound whenever you are assessing for the saphenofemoral junction incompetence. So the great saphenous vein and the short saphenous veins should be assessed full length for the diameter and to look for the perforator incompetence. So whenever you are suspecting there is some pelvic or iliac vein obstruction leading to varicosities, so that needs to be examined using transabdominal or transvaginal duplex scan. So the next non-invasive investigation is magnetic resonance venous imaging. It's non-invasive. It does not require any administration of contrast material. It mainly used for pelvic venous flow outflow obstruction, that is IVC, and iliac vein thrombosis. There are other investigations like venography and all, which is outdated, not used now. So the next is the how do you classify this varicose vein? Mainly we use CAP classification. C stands for clinical signs, E is for the etiology, A is the anatomic distribution, and P is the pathological dysfunction. So clinical classification. So it ranges from 0 to 6. So first is 0. So it means there is no visible or palpable signs of venous disease. 1 is a mild disease where it has only telangiectasia, reticular veins or malleolar fare. Second is the varicose vein. So after the varicose vein you see the edema, that is 3, and after the edema there will be inflammation and skin changes, that is 4. The skin changes are pigmentation, venous eczema and lipodermatosclerosis. And the next is after the skin changes there is ulceration. So by the time you examine, the ulcer would have healed, that is 5, and if the ulcer has not yet healed, it's still active, so that is 6. Then the etiology. What is the etiology for the development of varicose vein? EC is congenital, where there is abnormal valves or venous development that is present since the birth. And EP is primary. Primary is where the cause is not known, and most of the varicose vein what we treat is primary, and ES is secondary, that is mainly because of deep venous thrombosis causing obstruction in the deep veins. The pressures are transmitted to the superficial veins for the development of varicose veins. And the next is anatomical classification. So which venous system is affected? So AS superficial veins. So AD stands for deep veins, and AP perforators. It can affect perforators, superficial veins, or it can be combined. Pathophysiological classification. So what is the pathogenesis of the development of varicose veins. So it could be because of the reflux, the damage to the valves, or it could be because of obstruction, that is the thrombosis. So PR stands for reflux and PO stands for obstruction. PRO is reflux and obstruction. In the next video, we'll talk about the treatment, that is both non-operative and operative management of varicose veins. Thank you.